You are listening to the ADHD Support Talk Radio podcast. ADHD Support Talk Radio is sponsored by ADDclasses.com. Sign up now for a free webinar by going to www.addclasses.com. And with that, I would like to welcome back Dr. Ari Tuckman to ADHD Support Talk Radio. In just a moment, we're going to be talking about ADHD medication and the psychology related to medication. So welcome back, Dr. Tuckman.
Hey, it's always great to be here.
Yeah, I'm so glad you've come back and been a guest on the show several times. A lot of stuff together through ADDclasses.com. Before we get started talking about medication, can you let the listeners know a bit about yourself, who you are in relationship to helping people affected by ADD and ADHD, and also how they can get in touch with you after the show is aired?
Sure. So I'm a psychologist in private practice outside of Philadelphia, and I've written 3 books. So the first one was a book for clinicians called Integrative Treatment for Adult ADHD. The second was a book for the general public called More Attention, Less Deficit. And then the latest book is a workbook called Understand Your Brain, Get More Done, the ADHD Executive Functions Workbook. I do a ton of presenting, and I love talking about this stuff. And I do a podcast. There's, I think, 108 or 9 episodes at this point. I've had like 1.5 million downloads, which is sort of crazy, but technology works that way sometimes. So there's some good stuff out there, and you can get information on all of it at adultadhdbook.com.
Yeah, and I have to say, you do have some great resources, and your books are great. They're really easy to understand and follow for people with ADHD. So I definitely, highly recommend Dr. Tuckman's resources.
Well, I appreciate that.
Okay, great. So, yeah, medication and ADHD. I know you brought this up a while ago. You wanted to talk about the psychology behind ADHD medication for adults with ADHD. And before you came on, I was talking and saying I think this is such a great topic because so many people deal with it. It really affects them, yet not a lot of people are talking about it. The doctors who prescribe the medication, for the most part, don't discuss it. I really don't see it in that many books, but I see and hear people online that I come in contact with all the time struggling with these psychological issues related to being on medication or not being on medication.
Mm-hmm. Yeah, and it's interesting because in terms of the doctors not talking about it, I mean, it's sort of, this is not entirely true. To some extent, they don't have to talk about it as much. That's not really that true. There's sort of by the time you show up in a doctor's office, you've already pre-selected yourself. You know what I mean? And then there are all those people who have concerns about taking medication or doubts about it or inaccurate information about what it might do. They don't even show up in the doctor's office. And so those folks, if they show up in anybody's office, is more likely my office or maybe in your office, so to speak. So they wind up talking to us non-prescribers first. And I get pretty frequently calls from people who say, we want to try some behavioral stuff before we, try medication, or we don't want to try medication. So that's not an uncommon thing. I also get people who say, I've been taking medication for 8 years now and it's helpful, but I still want to do some other stuff. But it's always sort of interesting to me to have those conversations with the people who are resistant to the idea of medication in terms of what are their reasons for being hesitant about medication. Because, as a psychologist, my job in a way is to help people think through and make good decisions, whether that's about, how do I manage my time better, or, should I break up with my girlfriend, should I change jobs or whatever. So all the million things that people make decisions about. But one of those decisions also is, do I want to take medication or do I want to put my kid on medication? A big piece of what I do, especially with kind of the folks who are a little bit new to ADHD, is just provide basic information, because there's a lot of incorrect information out there. There's a lot of, people just have kind of like the wrong idea about medication, and in terms of the pros and the cons of what's reasonable to expect and what isn't. And this goes both ways. Some people think medication will do more than it really can, and other people think it's going to do a lot less, or it's going to be much more problematic or dangerous than it's likely to be. So, part of my job is to just provide basic good information so that I'm essentially kind of informing their decision. They still make the choice, but I want them to make a choice based on accurate information.
Yeah, because I think that's one of the big things. A lot of people are making their decisions based on fear surrounding information that isn't totally correct. I mean, some of it's just downright wrong and lies. So, I mean, that's tough right there when their decision isn't being made on accurate information. So it's so important that people understand, the real, truth behind ADHD medication.
Yeah. I mean, I think it's, probably none of our listeners will debate this point, which is that good decisions tend to be made on accurate information.
Mm-hmm.
Hopefully that's not like a controversial statement to make. Now, again, the fact that you're using accurate information doesn't necessarily mean that, we want to put ADHD meds in the drinking water.
Yeah.
It just means we want to have the right information. And, that applies to anything. Like if I'm deciding whether I should replace the roof on my house or I want accurate information. If I'm deciding, whether I should get the, chicken cacciatore at the restaurant, I want to know, what goes into that? Am I allergic to anything in that? Do I like those sorts of things? Again, you want accurate information so that you can make a good decision. The problem ADHD meds in particular seems to have far more than its fair share of inaccurate or outdated or just, I'm just going to say it, wacko, way out there kind of information circulating that is not accurate. And if you're basing your decision on that kind of stuff, then you're much less likely to make a good choice.
Yeah. And there are there are people out there who are selling complementary alternative treatments, and they'll scare people into using their treatment, talking about medication being bad. And I get a number of people contacting me, want to be on this radio show, and if any of that, when they contact me, if they put anything in there, if I go to their website to research them that starts using it as a scare tactic, it's I won't talk to this person. I don't want them on their show. It's one thing, if they've done research and, there are complementary treatments that have research behind it. But it's scary out there that, these people, because they're good marketers and they're using a scare tactic, and people just believe, and if they don't believe them, it's still there and it's in their mind, even if they don't think it's 100% true. So it's so important to really understand what's truthful about ADHD. So maybe that might be, one of the areas to talk about next is what are some of the common myths or misunderstandings that you hear people talking about with ADHD medication?
Right. Yeah, well, and actually before we even get into that, I think it's hard, you and I have been in this area for a long time, so we know what is bogus and what is valid and what's an overstatement and what's a scare tactic and all that. Most other people, especially if you're kind of new to this whole ADHD thing, we can't expect you to know that. Just like, I keep coming back to roofs because I got to, have mine fixed. I'm not an expert in roof repair. I don't, thankfully, although unfortunately I'm learning a lot, it's just not my area. So I am not going to know if if I get an estimate that this is valid or that's bogus, So it's hard being new to an area to really sort through. And if all you're doing is, wandering around the Internet, you can wind up in some very strange places. So, I think that when it comes to that, you want to look at, you want to find the credible sources. And I think the credible sources are things, are places like, CHAD or ADA, or ADD Resources, so some of the nonprofits out there who don't have an agenda one way or the other. So you're not getting your information from drug companies who have one certain agenda, and you're also not getting it from, New Age ADHD, CureYourADHD.com, whatever the hell, when someone has an agenda of a different kind. So, you want to try to find some of those neutral places, and then you want to check more than one source. And if you're getting the same information or similar information from multiple credible sources, then probably it's more likely that there's some real truth to that. But, I think back to your original question of what are some of the myths out there, some of the most common ones are things like that it's addictive, which is, it's like a lot of things. There's like a grain of truth in it, but it's not, but it's really overblown. So, if instead of taking one pill in the morning, you crush up and snort 5 pills, then you will absolutely get addicted to it.
Yes.
But there's never a doctor who's going to write you that prescription. Like if you actually, first of all, have ADHD, like it's been accurately diagnosed, and also, by the way, you don't have other things like bipolar or seizures or whatever, which are potentially problematic with these medications. If you have a true ADHD diagnosis without other problematic things, and you're taking, and the doctor knows what they're doing, and they write you an appropriate prescription, and you take it the way that you're supposed to, these medications are not addictive. So, the fact that, there's this grain of truth in it doesn't mean that it's true the way that it's often kind of put out there. So the fact that it has it's kind of the same thing. Like alcohol is potentially, addictive as well, but most people can handle alcohol without getting addicted. And the people who do get addicted because they're using it in the wrong way, People will also, in terms of some of the other, they'll talk about, it damages your brain and, all these risks and all this stuff, which again is not accurate, or to the extent that there is any truth in it, it's really sort of overstated to the point that it's really, in truth, it's no longer accurate the way that the information is presented. Or, so I think that a lot of the horror stories out there about medication for ADHD really comes from either situations where someone was incorrectly or incompletely diagnosed, so incorrectly meaning they don't actually have ADHD, they have something else, or incompletely meaning they have ADHD and they also have, let's say, bipolar disorder, which was not diagnosed, and then, they wind up with a problematic reaction to the medication. So either a problem in diagnosis or a problem in treatment. So like the doctor didn't really know what they were doing and prescribed way too much, or it wasn't monitored correctly, or the person was taking it incorrectly, or, like there was some problem in how it was done. So, but it's kind of like, I don't know, the fact that someone drank too much and then got behind the wheel and got into a car accident shouldn't be an indictment of alcohol in general. That should be an indictment of this person and the situation they were in and the choices that they made. So, I'm going to come across in this interview as being very pro-medication. And, in full disclosure, really I am, for ADHD at least, not for everything else necessarily. But, I like the medications that we have for ADHD. And the reason why I like them is they've been around for decades, so we have a long history of knowing what the benefits and risks are with them. There's hundreds and hundreds of studies that have been done on this medication. So again, we know what it is that we're dealing with. But also the ratio of benefits to side effects and risks tends to be quite good for the stimulants for ADHD, in the sense that the extent of the positive effect tends to be pretty decent, and the risks and the side effects tend to be, on the lower side and tend to be kind of manageable. So, they don't cause kind of irreparable damage that, so they don't affect like liver functioning or something in a way that you need to like get blood tests and then we're worried about it. So they tend to work pretty well. And I think that for a lot of the people who are resistant to the medication, they often look at only one half of the equation here. So, the one half of the equation is what are the potential benefits versus the risks. And the people who are hesitant say, well, I don't like those risks and side effects, so I'm not going to do it. But I think we have to also, if we're going to make a fully considered decision, we have to look at the other half of the equation here, which is what are the risks and side effects of not treating ADHD?
Oh, definitely.
And as much as, maybe I don't like the idea of putting kids with developing brains on medication, what I also really don't like is kids doing badly at school, having more kind of failure experiences in terms of forgotten homework, feeling embarrassed with a teacher, being treated poorly perhaps by a frustrated teacher, more arguments with parents. I don't like the idea of distracted driving and the higher incidence of car accidents. I don't like, impulsive sexual decisions and perhaps, unplanned events that come from that. I don't like adults not performing at their best at work and therefore not, excelling in their career as they otherwise would, which means less lifetime income. I don't like couples fighting endlessly over this kind of untreated ADHD stuff. You have to consider all of that, and it's sort of the analogy that I use here is, I would never take a medication that makes me feel absolutely awful, causes me to puke my guts out and lose all my hair. Like that sounds like a terrible medication to take, except if I have cancer and my alternative is to die in 3 months. If that's my alternative, I will puke my guts out every day for the rest of my life if it means that I get more life on this world. So we have to consider the other side of it. And I think that often, when I have people in my office and I present that side to them and I sort of, make it clear, like, all that stuff that brought you here in the first place, that's the stuff that we're talking about. Like, that is the stuff that is going to continue to be difficult and will continue to remain if we don't at least consider the possibility of medication. So I'm not saying you have to take it. I'm just saying let's not rule it out without really thinking about it.
No, and I think that that's something that you as a psychologist, it's going to be very helpful because I'm sure very few people have helped them look at it that way and, realizing that, weighing the pros and the cons and, maybe, they make a life change is going to be helpful from what you, say to them.
Yeah, and again, it's a matter of making a fully informed, fully considered decision. So I'm not saying that everybody has to walk out of my office and, call their doc as soon as, from the parking lot or anything. I'm just saying that I want people to make good choices about it. And for some people, it's the right thing, at least at this time in their life, and for other people, it's not, and that's fine. Again, I'm not saying everybody needs to take medication, and I certainly have plenty of clients with ADHD who don't, but I want them to not take medication for the right reason. Yes.
And, there's some people that I've talked to, like, oh, my gosh, it's such a hassle to take medication. I have to go to my doctor once a month, and I have to fill the prescription, and then the pharmacy tech looks at me like I'm a drug addict because it's a schedule whatever. So, there are some downsides that people, and that's, realistic, but then it's weighing that, okay, 10 minutes or half hour a month of hassle, does that, outweigh the fact that if you took the medication, it would help you be really productive 99% of the time? That's something to really look at, both sides. And, there are lots of different reasons, and sometimes, the people that's the reason they'll say or they'll use, but there are, other underlying reasons why they don't want to take the medication or are afraid to.
Yeah, definitely. And, I think it's, there's also kind of the other side of this is that once people try it, do they feel like it's working it's not a simple thing. It's not like we just take a blood test and say like, oh, well, yeah, you're in the therapeutic range. There you go. It also depends on what are you looking at? Are you looking at the benefits or are you looking at the side effects? And, someone who is kind of resistant to the idea of medication, like let's say a teenager, is going to focus on the side effects. I hate this medication. It makes me not hungry for lunch. And of course I'm always thinking to myself, like, I can't imagine your high school cafeteria food is really that awesome that it's a crime to miss it. But, but they're like vehement about how important it is to eat lunch or something, which just like you're saying, like that perhaps is a reason, but it ain't the reason. Or alternatively, the other side is medication can be helpful, but it's not a magic pill in the sense of again, and let's kind of use a teenager as kind of the ultimate example. You put your 15-year-old on medication, it's not like instantly they're going to be on the honor roll. Because if they are not interested in school because they're just so burned out on it, or they have a terrible relationship with their teachers at this point in the year because of all the untreated ADHD stuff, and they have terrible work habits, they're smoking too much pot on the side and whatever, medication might help, but man, there's a lot of momentum where we need to kind of go against, or there's a lot of other things that need to happen too. So it's not like, you take a couple pills and all of a sudden everything changes in your life.
Yeah, so that is a big one I've dealt with over the years, is people expecting way too much from the medication and then just, it doesn't work, I'm not taking it anymore, or also not understanding like the biological, effects of medication, especially in women with hormones, and women go through menopause, or, their menstrual cycle affects medication, and for 3 days a month it might seem like nothing's working. So, I think that's a big thing, is just expecting way too much and not understanding the interactions with the medication that, could be affecting its, whether it's working or not.
Absolutely. And I've had multiple people where, they say like, I don't know, the meds are just, they seem not to be working so well anymore. And then we start talking about it, and, lo and behold, it turns out they're getting like 4 or 5 hours of sleep a night.
Yeah.
I'm like, no wonder the meds aren't working. The fact you're not crashing your car into a tree in the morning says that maybe it is doing something,
Yeah.
So it's not like you can take medication and then, be sloppy about other things. Like everybody in the world, you still have to get enough sleep, you still have to eat well, you still have to, put some effort into staying organized and planning your day and thinking about priorities and resisting temptations and, all this stuff that everybody in the world has to do.
Well, thank you so much for listening to ADHD Support Talk Radio, and I would like to thank Dr. Tuckman for taking the time to come on today and talk about the psychology surrounding adult ADHD and medication. Dr. Tuckman will be back again next week to continue this really interesting and informative discussion. In the meantime, if you would like to learn more about Dr. Tuckman or get in touch with him, go to his website, www.adultadhdbook.com.